Hi everyone, my name is Mithil and I'm a third year graduate student at Mercy University College of Pharmacy. Today I'll be presenting my poster titled Employing Novel 3D Printed Oral Dissolving Films for COVID-19, Buccal Immunization of Microparticulate Vaccine Encapsulating the Spike S1 RBD protein. Firstly, I would like to address the question that how COVID-19 has affected how my research applies to the real world. And I would like to start by mentioning how COVID-19 has caused havoc with the ever-increasing number of cases and deaths worldwide. And the current particulate vaccines against COVID-19, the mRNA vaccines, they require cold chain storage and they're administered by intramuscular route, which is a non-invasive route and highly non-patient compliant. There is an urgent need for a patient compliant non-invasive vaccine which can be self-administered, which can lead to rapid global immunization, which is highly critical. Moreover, invading the virus upon encounter is highly desirable to avoid contracting the infection, and this can be attained by mucosal immunity. Further, use of novel 3D printed technology is essential to automate this process of formulating oral dissolving films. We all know that the spike protein on the SARS-CoV-2 virus is highly immunogenic, and it consists of two subunits, the S1 subunit and the S2 subunit. The S1 subunit consists of a RBD protein, which is the receptor binding domain, and this is the domain that binds to the ACE2 receptor on the host cell that leads to the entry of the virus into the host cell. Thus, this is the ideal vaccine candidate, and thus we chose this vaccine candidate for our further studies. Firstly, we formulated the microparticles using the spike S1 RBD protein and also for adjuvants using PLG polymer with the double immersion method. And we further characterized these for size, polydispersity index, setup potential, and encapsulation efficiency. We further formulated oral dissolving films, which were incorporating these microparticles using the 3D printer, and we formulated a bilayer oral dissolving film which consisted of a mucoadhesive layer with the microparticles as seen here and a backing layer. We further administered these oral dissolving films to murine model in vivo according to the following timeline, and we collected serum samples to analyze the presence of antibodies with the help of ELISA. Our results indicated that the size of the microparticles were found to be about 700 nanometers, and the PDI or the polydispersity index was found to be about 0.65, which means that it was not highly variable in distribution. The zeta potential was found to be minus 20 millivolts, which indicated not much aggregation and more stability, and the encapsulation efficiency was found to be around 88%. We further characterized our oral dissolving films to see that the diameter was about 4 millimeters, the thickness was about 128 micrometers, the weight was about 9 milligrams, and the surface pH was 7, which was the neutral pH, which was desirable, and the disintegration time was about 180 seconds. That indicated that it's a fast dissolving oral dissolving film or oral film. We further characterized for visual inspection using SEM, and we further also performed ELISAs to understand the levels or the serum levels of IgG and IgG subtype and IgA, which is an indicator of mucosal immunity, and we found that the IgG response was highest after at day 6 as compared to day 0 when the mice were not immunized. Also, the IgG1 and IgG2A levels were found to be highest after immunization as compared to day 0 when the mice were not immunized. The IgA levels were found to be highest, which was highly desirable since we wanted a mucosal immune response, and this was observed with the IgA response. Thus, with this, I would like to conclude that in this study, we formulated 3D printed oral dissolving films, which incorporated the spike S1 RBD protein as microparticles as a subunit vaccine against COVID-19. And the microparticulate vaccine administered using oral dissolving film exhibited the presence of antibody response which is essential to produce or provide a robust immune response against the deadly coronavirus. With this, I would like to thank you all for listening to my presentation.